Our models like this are all lefts. And the first thing we have are the extrinsic eye muscles. These are the muscles responsible for moving your eyes around to look in different directions. So these muscles we see on the surface of the eye. The first four are the rectus muscles. And being a rectus muscle means the fibers come straight back off the eye. That's what rectus always means. They're sort of going straight along the long axis. So on the top, we have the superior rectus, right? And on the bottom, right here, we have the, and on the inside towards the nose, medial, and on the outside towards the ear, lateral, right? So superior rectus on top, inferior rectus on the bottom, medial rectus closest to your midline, and lateral rectus closer to your outside line. So the rectus muscles aren't bad. Those muscles are responsible for the cardinal movement. So superior rectus pulls your eyes up, inferior down, lateral would pull this eye this way, and medial would pull this eye this way. We also have eyes or muscles to move the eyes on angles. You see this white stripy bit on top of the eye? Right up at the top? That white stripy bit on the top is part of the superior oblique muscle, and it will pull the eye on an angle. If we look on the bottom of the eye, we can see some muscles on the side over here, and that's your inferior obliques. So superior oblique is the white tendony thing on top. Inferior oblique is the muscle running sideways on the bottom. So the muscles aren't too bad? All right, next up is fibrous tunic. And when we look at each other's eyeballs, what we're mostly seeing is fibrous tunic, because that's the outside of the eye. The white of the eye is called the sclera. So the white part of the eye is the sclera, and the clear part of the eye is the cornea. So the white is the sclera, and the clear at the front is the cornea. You'll note if you look at the eye on its side that the cornea kind of bulges a little bit. See how it bulges forward? And that bulging is what lets your contact lens sit in the right place on top of your cornea, because it's got a different angle to it. Corneas are actually very easy to transplant. Normally someone needs a transplant. They're very sensitive about tissue matching and all this sorts of stuff. But corneas have very, very little blood flow. So as a result, your cornea goes bad, they can put my cornea on you. And that's one of the most common things they'll take if you're an organ donor, because the odds of one of your major organs matching up is pretty low. The odds of your corneas matching is very high. So corneas are quite commonly thieved off of bodies if you're an organ donor. All right, we start going into the eye, and the first thing we do is get to the vascular tunic. And the vascular tunic is this browny layer that I exposed by removing the fibrous tunic. All the brown surface that we're seeing around here is called the choroid. So the brown we see around here is the choroid. The choroid contains a lot of the blood vessels that are going to the eyeballs. That's the job of the choroid. If we come to the front of the choroid, do you see this white ring that runs around the front of the choroid? That's a part of the ciliary body. And the ciliary body are the muscles responsible for changing the shape of your lens. So if I look up close, I have to bend my lens really hard to look at something up close. Whereas if I look something further away, I can use my emmetropic eye, which is to say my relaxed eye. So that muscle that moves your lens is here. Remember, the extrinsic muscles move the direction of the eye. This would be an intrinsic muscle, the ciliary body, because it changes the shape of the lens. If we keep going forward, we get to the iris, which is the colored part of the eye. So when you say what color is your eye, we're really saying what color is your iris. How many colors are there contributing to the iris? One. The only color they have is brown. So if your eyes are really brown, you have a lot of melanin. If your eyes are blue, you have very little melanin. And if you're green or gray, you're somewhere in between. But there's not actually all these colors. There's melanin or there's no melanin, and those are the extremes.
So are babies born with blue eyes because they have no melanin?
And
right.
What is it when your eyes can change? Eye color can change?
Yeah, some people's eye color changes a little bit. Mostly it depends on the light. It's more of a trick of light.
How do people have like one blue eye and one green eye?
That's again, which just be a discrepancy in the amount of melanin that they possess. Yeah, albino you don't make pigment, which is why their eyes look basically pinkish, right? Yeah. All right, we then get to the pupil. And the pupil is going to be the hole in the middle of your iris. Of course, the size of your pupil changes because the iris has a dilator papillae and a sphincter papillae muscle. Yeah, I think that's right. That are responsible for opening and closing the iris to make the pupil different sizes. All right, we go inside now the vascular tunic, and I get into the sensory tunic. The sensory tunic is going to be this tan-colored surface most of the inside. And all that tan you're seeing is the retina. So all that tan color deep inside the eye is going to be the retina. I'll try and show you this, but it doesn't show up very well. If you look at the very back of the retina, you see where my fingernail is? And you see someone's penciled on a little half circle? You see what's a little bit pink in the half circle? I know this is asking a lot. If you have it right there, you'll see there's a slightly pinkish spot. That slightly pinkish spot is your macula lutea. So the pinkish spot is the macula lutea. And you can't see this at all because there's no feature, but in the middle of the macula lutea is a spot called the fovea centralis. Your fovea centralis is the port of your eye that if you're really focused on looking at one thing, so I'm reading the words of this slide, I'm adjusting my eye to put the image of those letters on my fovea centralis, because it has the sharpest, crispest vision of any part of my eye.
Where was that on the model?
Again, I try and show you, but I know it doesn't show very well.
So what part of the eye messes up, like when you can't see?
I'll explain that with the lens. Deal?
You can see it.
So right here, it's a pink circle at the back. That's macula lutea. Do you see the yellow half circle at the back of your eye? That's your optic disc. And the optic disc is where all of the optic nerves exit your eye to go back to your brain. The catch with the optic disc is that where you have that yellow half circle, you have no photoreceptors, so you can't see in that spot. Meaning each of your eyes has a blind spot to it. Now because you've got two eyes going all the time, they cover each other's blind spots and you don't know. And even if you only had one eye, your eye moves around so you don't notice it. But if you go on the internet, go on Google and type "find my blind spot" or something like that, and they put two dots on the screen and you cover one eye and move your head in and out, and you can get it where you can't see the other dot if you focus on the first dot. Now a lot of times, she likes to use this poster up here for the back of the eye. Because you can see right here's a circle, and this circle is your macula lutea. There's a dot in the middle for the fovea centralis, and over to the side you can see the optic disc. So this commonly shows up on the poster, or on the test.
Wait, which one is fovea centralis?
The fovea centralis is the dot in the middle of the macula lutea. You can't see it on the models, we just imply it usually. Okay, now we get to the other structures. And the first of the other structures we have is the lens. The lens sits up in the front of the eye, and the lens is responsible for taking the image. It actually inverts it, so it flips it upside down and backwards, and must bring it into focus on the back of the eye. If you have nearsightedness or short-sightedness, like you were talking about, what it means is the eye is in essence too long or too short for the lens. And as a result, the image can't get in focus. You know when you're playing with, it might date me a little bit, but overhead projectors? You guys vaguely remember overhead projectors? And you had to dial that lens thing up and down to make the image, and if you're too high, it's blurry, and too low, it's blurry. It's the same thing. That's what your lens has to do. If you have an astigmatism, what that means is that you have a warp in the lens, so an unusual warp or bulge, and that has to be corrected as well. The other thing that happens is this. Your lens gets thicker as you get older. So it kind of like it keeps adding other layers, more and more layers, and your lens gets thicker and thicker. That's a problem because as it gets thicker, the muscles have a really hard time changing the shape of it because it's just gotten so thick and strong. It doesn't affect your long-range vision, so to look at something far away, my lens can stay in its natural shape. But when I try and look at something up close, my eye muscles have to squeeze my lenses to let me do it. So you know the joke, or you may have witnessed it yourself, where Dad's reading the morning paper, and he's got the paper kind of like all the way out like that. And the joke is you need glasses when your arms aren't long enough anymore. That's because as you age, the lens gets thick and you can't look, you can't focus on anything this close. You can't bend your lens that much. So you end up reading with things further and further away. It's called presbyopia, which means old eyes, and everybody gets it. So I'm 38. I've never needed glasses. Within the next 10 years, I'll probably need glasses.